This was amazing. To be able to see my own specimens being run through these machines, and yes, and knowing that thousands of other people's blood are going through there, even like you said, thousands of specimens a day. You know, just knowing that the staff, when they're looking at these things, like when they do see something that's bad news, you can see the general concern on their faces, that they are concerned for these people and they don't even know who they are. You know, so you have complete strangers caring about you. But being able to see all of, you know, my specimens going through all these things and knowing that, okay, so I just went through the most painful bone marrow biopsy of my life, and then to see it in this little tube, and then to see all the tests that it was going to go through, that really opened my eyes too, that they have to do all this testing. Or there's so many different types of these leukemias and cancers that they have to get it right down to that specific one to know how to treat it, and all the science that goes into that, down to the genetics part too. It really amazed me. It blew me away. It was a really cool experience to be able to see all of that. I'm Brenda. I am one of Dr. Bixby's leukemia patients. I was diagnosed May 30th of 2014. That's the day that I came up here. They diagnosed me in Kalamazoo, Michigan, and sent me here literally within a few hours. I didn't really have a lot of time to think, a lot of time to process any of it really. But I'm actually from a small town called Galesburg, population of like not even 200. No, I'm just kidding. It's we have about 2,000 people, but it's a pretty small town. But like I said, I was diagnosed by Kalamazoo, Dr. Raffi at the Cancer Center. He said that my case was very rare, my type for my age, and that it had gone on so long, not being diagnosed, that there wasn't anything that he could do for me. So when you hear those words, it's kind of like, are you telling me I'm dying? Or what's going on here? I guess I just kind of had a deer in headlights look, and he said, I'm sending you to U of M, and that's where they're going to take care of you. It was a really long, hard road. There were days where I really wanted to give up, but I didn't, obviously. So it was tough. Sometimes I still get emotional talking about it. There are some certain times during those 3 years that were harder than some of the others. But that's how I got here, I guess.
Okay, so I'm going to show you the one that was in your diagnostic one first, the one that showed the cancer first, and then I'll show you what your normal one looks like, because they're very different. So this is a bone marrow biopsy. Can you guys see that? Are you in focus? And what it's composed of, you see, the reason it's so painful is all these little pieces, these pink pieces, are bone.
Oh.
So it's going into your bone, and we call these trabeculae, and they should be there in every bone marrow biopsy because it's sort of breaking through the bone when we get some of this bone marrow. All of these blue cells, so these cells are the little round blue things in here. These are all those cells that we saw in your blood, and they're like taking over your bone marrow, and they're not allowing the bone marrow to make the other cells that you need to fight infection and to make red cells and to function appropriately. So these are all the blasts, so we call them blasts.
Wow.
And there's lots of them, right? They're like sort of filling it up, and that's what we see. Like that's very common with what you have, that you would have like all these cells like filling up your bone marrow, and that's why you felt terrible. So then I want to show you what your marrow looked like later when you were better. So we'll go on like really low power here, so you can see again, like it looks very different than the other one, right? We still have that bone because we have to torture you, and we stick that needle in there. But now we have a lot of those open holes, like those fat spaces. And that's what you should have.
When they told me I got to see all this kind of stuff, it really excited me, you know, because I to be able to see when I was diagnosed and to now.
And like how different it is.
Yeah.
Yeah.
Yep.
That's great. I'm glad that things are going really well.
Yep.
In your case, they actually took a piece of bone, they took an extra piece of bone and basically crushed that up and separated out all the individual cells inside a piece of bone. So that's
Wow.
another technique that they can use. And so the idea is that when they take up the crushed up sample, all the different cells are kind of separated apart. And then they run it through the machine, and each cell passes through one at a time, kind of single file. So you can run like a million cells in like a single line through. And as it's going through, they use a laser to basically zap each cell, and it will kind of once you zap it, it'll express kind of a special pattern of different colors that then we can use to say, okay, when it has this pattern, it has this type of marker. Then on this plot, what you can see is we separate out the different types of cells using different properties, so we can color code them. So like over here, for example, is where your lymphocytes will show up. So your lymphocytes are like your immune cells. And then over here are where your neutrophils, like you were seeing in the blood, will show up. And then here is where we detected this abnormal population that we were talking about. So we can see that there's kind of a clump here that you can circle and look at. Looking at these different plots, we were able to tell that there's something abnormal about them, and then we're able to tell that this is a leukemia and that this is a B-lymphoblastic leukemia based on those patterns.
We keep all of these materials, like this is the paraffin block that we embed the biopsy, so this is the thing they took out of your
That's
hip.
the actual biopsy.
And we embed it in this waxy material, and then we cut it really, 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 really thin, and we put it on the slide, and we put a stain on it so that we can see it.
That's
And
my
then-
bone marrow.
You pretty much own this. Like, we keep your assets, we call them assets for you, but you own this material, like this is yours.
Wow. That is
So if
really
you ever
neat to
want it-
see, though.
Yeah.
So my name is Lina Shao. I'm the director of the clinical cytogenetic lab. So this actually is yours. This is your metaphase. So each of us have 46 chromosomes. So the male have XY and the female have XX. But this is kind of like low resolution. So there are billions of base pairs in your genome. So it's all condensed to those 46 chromosomes.
U of M is amazing. The experiences I've had here, being told I had cancer, once I got here, they really took away a lot of the worry. All the staff, the doctors, everything, and even the people coming in from the lab, so polite and friendly and always having smiles. And I never came across one person who worked here who didn't act like they didn't want to be here. Being a patient and not getting to see all the things that you guys have recently let me see, you think, okay, they're taking more blood. Okay, I was sleeping. You're waking me up. It's 3 a.m. What are you doing? I think if people had a better understanding of why they were doing it, they would be like, oh, okay, here's my arm. Instead of kind of giving attitude like, I can't believe you just woke me up. Once you get to that point where you're in remission and you're just doing your checkups, it's a 100-mile drive. You're thinking, okay, I'm going there to get my blood done, see the doctor for a few minutes, and then I'm done. At least if you got to do this maybe even just once and getting to see all of that, you would feel that your time was more valuable. I knew pathologists worked with blood and specimens and things like that, but I never knew it to this degree. So it's taught me a lot. Just being able to see my bone marrow. Nobody ever thinks that they're going to get to see that kind of stuff. Even as a patient, I wouldn't have thought I'll never see that. They have all these specimens in me. They have my bone marrow biopsies, yeah. But would I ever get to see them? I never thought. And just knowing the pain that I would go through for those, just thinking, okay, I know that there's a reason they're doing these. Okay, I can handle this. It was hard sometimes, and then seeing all the machines that it actually goes through and seeing the process, it just, like I said, it blew me away. It's like, wow. And getting to see my chromosomes. Like you said, people don't really get to see that. To see what makes me, on this sheet of paper, this is me, my DNA, my chromosomes. It's looking right back at me, and I'm looking at myself on a microscopic level, and other people don't get to see that. So that's been a really cool experience. If I would have had something like this to watch, it would have helped me a lot, because like I said, just letting people know that they're not alone, that other people are going through this, other people have been through this and have made it through. you know, I think it would motivate them. Like, okay, she made it. I can do it too.